Welcome back to Awaken with Me, helping you become aware and empowered on all things health and wellness on your health and healing journey. Hello, and welcome back to Awaken with Me. I'm your host, Nic McDonald. And for those of you who don't know, it's your first time here, I'm a life and wellness coach, and my objective is to help my clients thrive and not just survive. I incorporate my 3-step approach in order to do this, which is acknowledge, act, and achieve. And through those methods, I help my client become better versions of themselves and amplify showing up in spaces around them with more intention and purpose. I do this via one-to-one coaching, course offerings, and workshops for various organizations and groups. People can also get started working with me via my Patreon account, and all of this can, of course, be found on my website, www.awakentoyourpassion.com. Today, we'll talk a bit about Eastern medicine and Western medicine. I started this podcast to bring awareness to certain conditions that are faced by women, especially autoimmune conditions. And I've found that over these last months, one topic that constantly comes up is Eastern practices versus Western practices. And so I thought it would be appropriate to delve into that a little bit more. Before I talk about what Eastern medicine is and what Western medicine is, I just want to talk a little bit about how people come to explore the differences in these two. So what I found is that a lot of times someone has to have had something major happen in their lives to change their health in a way, so they go exploring, right? Otherwise, many times, Western medicine is just fine, right, for the basics and the obvious problems. So, for example, and I'll use a woman who has been having abdominal pains, right, may go to the doctor and discover, and after a series of tests and trial medications to see if the pains go away, she might discover that she has fibroids, right? She may then be offered a series of options, whatever option there is to either shrink the fibroid, remove it, or even possibly removal of the whole uterus itself. Let's say she decides to shrink it, right? Hopefully this goes without complication, and we're also hoping that the fibroid does not return. Otherwise, she may have to repeat the procedure or eventually do another procedure to remove them or whatever else the doctor recommends. Now, this process seems quite straightforward, right? She was able to go to the doctor, identify the problem, right, after a series of trials, right, that hopefully was probably met in a couple of visits, maybe 3 to 4, whatever the case. It seems quite routine, normal. What I found, though, is that many times when people are having more difficult situations where they're going to the doctor, right, for things that cannot be explained. And some of these symptoms I've come to realize are similar for the people faced with these situations. So, for example, chronic pains, fatigue, dizziness, numbness, tingling, and other manifestations that tend to disrupt a person's overall life, right? these things send them to the doctor. But what they find is that it's not so straightforward. They're constantly going back to the doctor. They're going to see different kinds of doctors and specialists. They're having to do all kinds of tests, blood tests, and other kinds of tests. And all of these things are coming back normal, but their symptoms remain or are elevating. So it's a scary situation, right? Like, what's happening? And that's kind of what I went through in my situation a year ago, when I was exploring what was happening to me, and all my tests were coming back normal. And in doing my own research, I connected to other people who were faced with the same or similar situations. And so what I've come to realize is that people start exploring other options. And this is when Eastern medicine and Western medicine become a topic that people talk about. As you're beginning or continuing your wellness journey, be sure to check out the wellness and self-care resources on my website, www.awakentoyourpassion.com. So when we start looking at Eastern medicine and Western medicine, we see some clear differences, including the fact that each has their own benefits. Western medicine, based on clinical research and methods, often use information from these grouped and generalized trials to treat medical problems. It rarely addresses the root cause of the problem, and treatment often includes medications and surgery. So, for example, someone goes to the doctor with a headache. There could be many causes of why someone's head might hurt them, and there are many forms of headaches. So potentially, after that series of questioning, tests might be required, imaging or blood tests or whatever. Eventually, some medication might be prescribed for a patient to see if that helps to address the problem. And if after 30 days, which potentially is roughly the time frame medication is usually given, then another set of medication might be prescribed to see if that can solve the problem, if the patient is still having the same problem. If the issue isn't deemed drastic enough for surgery, then medication might be something that the person ends up taking for a long period of time to soothe the problem that they're having. The issue is that this doesn't really treat the root cause, like why are you having the headache and why won't it go away? Why do I have to continue taking these medications in order to get any kind of relief? So there are numerous studies that talk about the link between a mental health and a person's physical health. So some of the topics include depression and the immune system and how those are linked, and between anger and anxiety and heart health, and or even fatigue. And some of those are common. So when we look at Eastern medicine, it takes into consideration the person's whole health, mind, body, spirit. Also known as alternative medicine and holistic medicine, Eastern medicine often relies on natural resources like teas and herbs, essential oils drawn from extract of fruits, vegetables, and spices, and eaten naturally as a way of providing cure and treatment. Using methods like hair analysis and blood tests, the goal is to understand and treat the root cause of an individual's problem. One disadvantage of Eastern medicine that's often brought up is the fact that research and regulation is limited. This makes it very important to work with a professional, either someone in alternative medicine medical practitioner, a nutritionist, or a specialist coach. As I mentioned before, both Western and Eastern medicine has their place. So for example, of course, Western medicine will be most important if there is an emergency that's happening. And Eastern medicine is good for more long-term health and self-care practices. I'm totally no expert on either of these, and each person will have to make their own decision as far as how they move forward with their health. Based on my personal experience, I've come to 3 realizations. 1, oftentimes people wait to have a life-changing moment to seek change. And I have to say that is what happened to me, and I hope for those of you listening out there that it doesn't have to be the case, which is one of the reasons why I created this podcast, to bring more awareness so that people can start making these changes without having a big aha life-changing moment. 2, diet changes is often a main thing people realize they need to make. There are a lot of people having gut issues, and there is a clear link, like research being done on a link between gut health and someone's overall health, and how having an unhealthy gut can disturb the rest of your body, cause different symptoms, headaches, numbness, tingling, pains, just a lot of different things. And number 3, people often arrive at self-care as being a very important factor in health. Having come across the association between the mind and the body, and oftentimes how emotional traumas tend to manifest as physical traumas, and being more attentive to that link and how we treat ourselves, how we care for ourselves on a regular basis. A lot of times we view self-care as being selfish, and we're so busy and caught up in the action of the go, go, go movement that we rarely find time to just be, to just be present, to just be in the moment. And even when we try, right, it's very hard. Think about someone coming to meditation for the first time. It's so hard to settle the mind and to just be present, to not think about anything, to not be worried or concerned about the next minute, the next 5 minutes, and maybe tomorrow. And so the thing is, right, I heard someone say recently, you cannot pour from an empty cup, right? What are you going to get? Nothing but air. So in order to show up as your best self in the world for the people around you, you first need to show up for yourself. And that is self-care, right? Taking care of you, your needs. And so you have to start somewhere. And my suggestion is that you start small. Maybe just taking a minute each day to just be present in the moment. Not think about what the next minute is going to bring to you. Maybe taking a stroll through the park if you enjoy things like that. Some people also do yoga. But anything that you do, I say start small. You don't have to do a whole half-hour yoga session. If 2 to 3 minutes is good for you, then that's where you start. I think the main thing is to pay attention to yourself as an individual. What is good for you and what is working for you in this moment? That is what you need, and that is good enough. On this self-care journey, you'll find that it's important to get to know yourself on a deeper level. How do you respond in different situations? Situations that are upsetting, situations that are uplifting. How do you respond? How do you respond with different people in your life, right? And so I encourage you to take the self-awareness quiz. It's available on my website in the resource section. And that will help you to do that kind of deep questioning for yourself, just to get to know how you respond. And that will help you to get the answers that you need in order to make certain shifts that you'll need to make to start taking better care of yourself. So today's learning outcome is that no matter what method you are using for your health, whether you're incorporating Eastern medicine, Western medicine, or a little bit of both, self-care is really essentially at the root of everything. You have to be involved in your care at every level, because at the end of the day, you are the one who knows truly what you're going through. So be a part of that process. Thanks for joining us on today's podcast. If you haven't yet done so, hit the subscribe button for new content every 2 weeks. And be sure to visit my website, awakentoyourpassion.com, for more resources. Until next time, take care.